Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about regrets after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So unfortunately, knee replacement surgery is not successful for everyone who has it. And there's different studies out there, but roughly 20% or 1 in 5 people are not satisfied after knee replacement surgery based on some of the research and studies that are out there. And this is for a variety of reasons, but I want to really jump into, okay, right now you may regret that you had a knee replacement surgery. Well, what can we do from here? What can we look at? What can our attitude be? What direction can we take? So first thing I would definitely recommend, if you haven't already, have a follow-up consultation with your surgeon. Especially if you are greater than 6 months out from your surgery and you're still having these pain, symptoms, these issues and concerns, definitely a follow-up with the surgeon is a good first step. They can take an x-ray of the knee, they can do an assessment, and they can rule out any significant red flags, such as an infection, loosening of the replacement, maybe the replacement is an incorrect or a poor fit, maybe you have a broken bone. We definitely want to rule these things out before we look at other options. So first off, have that follow-up appointment, have that consultation with your surgeon, or maybe even getting a second opinion from a different orthopedic surgeon. If no red flags come up, some things to think about is let's figure out why you're frustrated and why you regret having a knee replacement. Is it reasons for continued pain? Is it because you don't have full range of motion back in your knee? You can't bend it or straighten it to the extent that you'd like? Is it that you feel weakness in your legs and your muscles and you can't do the activities that you want to do? You're not as mobile as you wish you could be, walking, going up and down stairs, getting up from a chair. Maybe you're having pain at night still, or maybe it's something else completely. But really it's important to pinpoint what is the thing that is causing your frustration and causing your regret, and what are the strategies we can do to address that. Addressing continued pain after surgery is going to be a different set of strategies than addressing issues with stiffness or range of motion issues. They're similar, but there's going to be different approaches based on what you're frustrated and what your needs are. Big thing to keep in mind is just don't be overly hard on yourself either. People tend to blame themselves a little bit, and it's really not your fault the vast majority of the time. There's people who will work really, really hard after surgery and do their rehab and their exercises, and they'll have a great recovery and they'll feel awesome. And there's people who will work just as hard and not be satisfied and have not as good of an outcome. A lot of the recovery after surgery can be chance. It's just the genetics and the physiology and makeup of your body plays a huge role in that, and things that are really not in your control. So, don't beat yourself up. Most people, the vast majority of people, work really hard and do what they're supposed to after surgery, but sometimes our bodies just don't cooperate as we wish they would. So what you want to think of in that same tone is, there's many things that are outside of your control, but what is within your control? What can we do to help our situation as best we can? Are there strategies for pain management? So different modes of managing your pain. Maybe that's using compression, electrical stimulation. Maybe that's getting connected with a physical therapist or another health professional that can educate you about pain science and persistent pain, and definitely personalized strategies to help manage that pain for you. Maybe you have to continue with some range of motion and stretching exercises to help relieve some of that stiffness that you're still experiencing. Or maybe you just need to get in a regular physical activity routine. Maybe that's just some walking, getting in the pool, hiking, gardening, whatever that may be that you're able to do consistently. So understand that there's a lot outside of your control, but let's find those things that are within our control and start making those little steps to hopefully trying to address some of these issues. And a big thing I like to tell people is try mixing it up. If you find yourself in a rut and aren't feeling better, aren't feeling stronger, still having stiffness and issues, try doing something different. So if you haven't tried, cycling, either like a recumbent bike or even getting out on a road bike, give that a try. If you haven't tried the pool yet, maybe try going into the pool. Maybe get connected with a personal trainer or going to some group exercise classes. There's lots of different ways to do something different and see how your body responds to it. It may be you're just stuck in this rut of doing the same thing and not seeing that benefit, and you just have to mix things up a little bit. And another thing is you may just need more time. Knee replacement, recovery, and rehab is definitely a marathon. It's not a sprint. For the average person, it's going to take many weeks to many months, up to 6 months to fully recover. But really, it can take much longer than that. Some people, it may take a year and a half, even up to 2 years to really feel like, I've gotten over those barriers, those plateaus, and I feel fully recovered. Now, something to keep in mind is there's a difference between fully recovered and feeling like my knee is like a normal knee or like it used to be. There's a large proportion of people after surgery who they may feel recovered. They don't have that many aches or pains or concerns or issues, but they still feel that their knee feels a little different. It's not quite like their other knee. It just feels a little different. That's something that's very normal and can persist even after you feel like you're recovered in all the other physical domains. And just think about how you compare to prior to your knee replacement surgery. Unfortunately, it's like I was saying, it's not abnormal to have some lingering symptoms, some mobility deficits, maybe some pain every now and then if you do a little bit higher intensity activity or whatever that may be, some stiffness. But think about what those things were like. What was your pain level? What was your stiffness? How was your mobility prior to surgery? And for the vast majority of folks, even though you may have some lingering symptoms and you're still recovering, the vast majority of folks will say, I'm still definitely a lot better than I was before the surgery. And they would recommend, if they had a second chance, they probably would still go through the surgery because even though they may still have some issues, some symptoms that they're working through, they feel a lot better and a lot more mobile and can do a lot more activities than they did before the surgery. So it's good to maintain that perspective as well. I would also say consistency. Consistency is important with physical activity, staying on top of your pain, and just overall health and wellness. Especially if you're in a rut, you feel like you're plateaued, you feel like you really just wish you hadn't had this surgery, you feel crummy. Think about your overall health and wellness. This is your mental health, your psychological health, depression, anxiety, stresses. What are ways that we can manage these effectively? Pain and symptoms are multimodal. That means there's many different things that play a role into the pain that you experience or the symptoms that you experience. So if there's ways that we can address our mental health, if there's ways we can address our nutrition, maintaining a healthy body weight, maintain good social and emotional health, good spiritual health, good vocational and professional health and well-being, all these things can play a role. You may not think of that initially. You may just think of the physical aspects, strength, range of motion, scar tissue, muscles, tendons, ligaments. But there's a lot more that plays a role into your symptoms that you experience and the pain you experience. So definitely if you're in a rut and you feel like you're in a sticking point, look at those other aspects of your health as well. And sleeping, that's another big one that I didn't mention before. Make sure you're getting good sleep and practicing good sleep hygiene. So if you are someone who is unfortunately in that position where right now you're regretting that you did have a knee replacement surgery, I am sorry to hear that, and I'm sorry about that, but hopefully you can find some ways to focus on things that are within your powers and within your control to help make the situation a little bit better. And I hope this video provided some helpful tips for that. Again, please be sure to hit that subscribe button if you don't already. Please leave your comments, your questions below, and be sure to hit that like button as it helps spread this video to other viewers. Thank you very much for watching.